team for the Dallas Coalition for Hunger Solutions. On behalf of the action team, we want to thank you for joining us this afternoon for this important virtual roundtable discussion. Please note that the recording for this meeting will be available on YouTube at the Dallas for Hunger Solutions YouTube page in a few days. We will also be sending a follow-up email with the link. The mission of the Dallas Coalition for Hunger Solutions is to empower residents to gain equitable access to healthy food. Since 2012, the coalition has been bringing leaders together who are engaged in the work of addressing poverty and hunger to take collaborative action. This work is carried out through 5 action teams focused on hunger, child hunger, faith, community hunger solutions, senior hunger, urban agriculture, and policy. The goal of the policy action team is to promote strong local, state, and federal public policies to improve healthy food access. The group does this by educating stakeholders like yourselves about important anti-hunger policies through educational events, keeping the public informed about policy developments through the Policy Matters newsletter, and building relationships with elected officials to educate them about the impact of anti-hunger programs. I'm honored to introduce our speakers and moderator for today's discussion. Today, we are privileged to welcome a representative from Texas State Senator Nathan Johnson's office. His name is Rudy England. He serves as the Legislative Director and General Counsel. Senator Johnson apologizes for not being able to be here in person. He is stuck in committee, but he's doing the goodwill of good job at representing Texas, and so we appreciate his commitment and time, but also welcome Rudy to be part of this panel. Senator Johnson was elected with strong bipartisan support in 2018 and represents the economically and demographically diverse district of Senate District 16, which comprises the northern part of Dallas County. As a freshman senator, he passed 22 bills into law, all with bipartisan support. His emphasis on improving the health of Texans prompted him to author and support a number of healthcare initiatives, ranging from medical coding to Medicaid expansion, with much in between. We are also privileged to have Steve Love, President and CEO of the Dallas-Fort Worth Hospital Council, which promotes collaboration, cooperation, and advocacy on behalf of its 90 member hospitals, including Children's Health. The primary mission is to promote patient safety, quality healthcare, and coordination in the delivery of healthcare within the North Texas market. Joining us all the way from Austin is Rachel Cooper, Senior Policy Analyst with Every Texan, formerly known as the Center for Public Policy Priorities, where she focuses on food and nutrition programs, as well as obesity. Last but certainly not least, our moderator for today is Dr. Valerie Hawthorne, who is the Government Relations Director at the North Texas Food Bank, where she is responsible for developing their public policy and advocacy program. And she's also a valued member of the policy action team. So before handing it over to Valerie, I would like to ask participants to stay muted throughout the duration of the meeting and encourage you to submit questions throughout the meeting in the chat function. We will be monitoring the chat, and we'll ask as many of these questions on your behalf if time permits. To our guests, we're honored to have you and look forward to learning from you. Without further ado, I will pass on the virtual floor to Dr. Valerie Hawthorne.
Hi, everyone, and thank you for the introduction, Denise. If there is a brief pause or delay in this internet, I apologize. I just got a note that says it's a bit unstable, so we will power through. I want to thank you first for taking the time for coming to learn more about Medicaid and Medicaid expansion. It in itself, it's one of those words that you hear all the time, Medicaid expansion, Texas needs to do this, but sometimes getting down to the root of what exactly that means is something that can help all of us become better advocates. So we kind of got the best here today, so I'm super excited to have them. So first off, I just want to see if there's any quick opening comments that everyone wants to give. And so Mr. Love, I'll hand it to you first.
Sure. First and foremost, I want to thank the Dallas Coalition for Hunger Solutions for inviting me to participate on this panel. And we're going to talk about Medicaid, and we're going to do it in a way that we hope even if you don't know a lot about Medicaid or about healthcare, we're going to try to keep it to a point where hopefully, one, we're clear, and two, we explain. But if you have any questions throughout the presentations, please let us know. But again, it's a real privilege to be here.
Thank you. And Rudy, thank you for jumping on right away to, I know that Senator Johnson is doing some great work, so we really appreciate you. Do you have some opening comments you'd like to give?
Well, first of all, let me just apologize again. As you all have been told, Senator Johnson's on the floor of the Senate right now, involved in a Business and Commerce Committee hearing having to do with the most recent situation with the weather and the electrical grid and that sort of thing. So he's well occupied on important business for the state of Texas and for the Dallas area. And thank you all for letting me step in. We're looking forward to talking about it. As everyone probably knows by now, Senator Johnson's major push and big priority this session is Medicaid expansion. And so glad to have the opportunity to talk to you guys about it. I've been working for Senator Johnson since he first was elected, and have been in the legislature for about 10 years. So hopefully I can be a decent stand-in for him.
You absolutely will. And Ms. Rachel Cooper, how are you doing? And welcome. Thank you for being here.
Thank you. I want to also thank all of you, the Dallas Coalition for Hunger Solutions, for inviting me. I find it really refreshing and empowering to see how connected the Dallas community is, and so involved in helping us move these issues, because if we're going to win, it's going to take people from every part of the state to speak up and share the need for these programs. And I also appreciate the fact that you're making the link between, you know, Medicaid, which does sound sometimes kind of abstract, and real people and food insecurity, and that, you know, these are the same group of people who are struggling at the food bank and don't have Medicaid, and we need to support lots of different supports to make it better for them. So thank you for having me.
Well, sure. Thank you for being here. And we'll dive right in. If you could, Mr. Love, I actually think that my daughter is on this call and she's in 6th grade. So could you give us a 1-minute explanation of what is Medicaid and who qualifies for it?
You know, that's a great question. I think Rachel did a good job of tying in some of the same people with social drivers of health. Medicaid is a program. It's funded by the federal government and the state government jointly. And it is a program where there are really two key components: the Medicaid component and then the CHIP component. CHIP is Children's Health Insurance Program, but it's really to help serve low-income people. Primarily, it'll serve children, pregnant women, disabled adults, and seniors in Texas. So it doesn't cover everyone. You have to meet certain means testing based on income level criteria, but it helps many people get primary care and keeps them out of having to come to the emergency room. So think of it as a great health program, but unfortunately, not all Texans are covered. But it is a eligibility determined by the state, but funded by the federal and state governments together.
Oh, thank you. That was a perfect introduction of what is Medicaid. And so, Mr. England, I'm going to ask you, as we dive into this conversation, what does the term Medicaid expansion mean, and who gets to decide if that event happens?
So Medicaid expansion is a part of originally the Affordable Care Act. But what it does is it expands Medicaid to folks who are up to 138% of the federal poverty level, which for those of you who don't know, Texas has the highest uninsured rate in the nation. And the effect of expanding Medicaid would be to essentially provide insurance to all of those folks who are at 138% of the federal poverty level or below. And that's a significant number of people in Texas. As Steve mentioned, right now, the Medicaid programs in Texas cover just specific populations. And so there's a whole swath of folks who really don't qualify for Medicaid, even if they are extremely poor. And who decides is essentially the state government. So it's both the legislature and, of course, it would have to go through the governor's office too, potentially. So it is a state government decision whether or not Texas expands Medicaid.
Okay, and we'll get into a little bit later to expand on that in the state government specifically. And Ms. Cooper, I wanted to ask you, what is the coverage gap? You know, he mentioned folks that are 138% and below qualified, but what is this term coverage gap that we may talk about?
So it can get very confusing because it is very technical, because you're talking about two separate, huge programs, one being Medicaid and then the other one being the Affordable Care Act, or what we all call Obamacare. And there's this huge swath of people who don't qualify for either. So in Texas, as Mr. Love was saying, if you're a very low income parent, you can get Medicaid. But literally that means in real life, you have to earn less than $230 a month. If you're a mom of, say you're a mom and you've got two kids, you can earn up to $230 a month and you can get Medicaid in Texas. And that's a state choice. That's how we decided to make it that low. But you can't get any help paying for insurance and getting on Obamacare until you earn up to about $1,800 a month. Everybody else in the middle is out of luck. They have to pay out of pocket full price, and they can't, because these are the folks who make our economy run. These are those, a lot of them are those folks that we decided were essential during the, this emergency, but we don't pay them for the importance of their work. So these are the healthcare aides, the supermarket clerks, the folks who, make the everyday hourly wages that are too low to pay pay their bills and buy health insurance out of pocket, because their jobs don't offer health insurance, and
Right.
they fall into that gap.
So that coverage gap, also, if you work, you're likely not going to be receiving health insurance from your company, right? If you're an hourly worker, you're not eligible for those things. So we'll talk a little bit more about that in a little bit. And the last bonus question, until of the level setting vocab, I will toss it up between Mr. Love or Mr. England, who wants to take it. What is the section 1115 waiver or 1115 waiver that we hear so much about?
Rudy, do you want me to take a shot and then you clean up my mess?
I'm sure you'll do a great job.
Okay. That's a great question, Valerie. The Medicaid 1115 waiver is a little separate and distinct from the Medicaid that we've been talking about. This waiver was built with two different funding pools. One to help with uncompensated care, and one, and I'm not getting technical, I'll explain this, delivery system reform incentive payments. We call it DSRIP. Now, you've heard what it is. These are programs that providers put in place to help people with chronic illnesses, mental illnesses, a lot of things related to normal coverage in Medicaid would not be paid for. So we were able to do special programs, special projects, and help people through this Medicaid 1115 waiver funding. Now, that is going to expire, and that program I mentioned, DSRIP, which are just these special projects to help chronic illness, it's going to fade away in the next 18 months. So we did get that 1115 waiver renewed for 10 years, but there's a lot different moving parts in the renewal than the original one. So we're working to see how we can use the funding there to supplement, if you will, the traditional Medicaid. There's one big distinction, and I know Mr. England will point this out. Even though this Medicaid 1115 waiver is renewed, it's not a substitute for expanding Medicaid coverage under the Affordable Care Act. So Valerie, I hope that worked, and I'll let Rudy finish it up.
Yeah, so a couple of important points in what Steve's talking about. One of the things that an 1115 waiver can do are the things that he spoke about. Another thing you can actually do with an 1115 waiver is expand coverage to include all of the folks who would be otherwise covered under Medicaid expansion. And the second most important point about that is that under the 1115 waiver that Steve's talking about, the funding between the state and federal government is 60-40, where the federal government pays 40%, the state pays 60%. But if you expand to cover all of the folks who would be in the expansion population via an 1115 waiver, that's another way to get to a 90-10 match where the federal government pays 90% and the state pays 10%. So those are two big distinctions of an 1115 waiver. So you can expand Medicaid under the Affordable Care Act, but you can also do this 1115 waiver where you pull in all of those folks who would be in the expansion population and still get the 90-10 match. An important part of doing it under an 1115 waiver, rather than simply expanding Medicaid, is it allows you states to do it their way, right? To add certain things, add certain programs that would potentially be things that, at least in Texas and in more conservative states, more appealing to folks on the more conservative side of the spectrum.
Okay, and so we'll talk about in a little bit about which way we think we would really like to see it go. So here's to our let's talk about the two sides of this part. So Mr. Love, in an interview you gave in 2012, you said very sternly that if we reject Medicaid expansion, the uninsured are going to end up in emergency rooms, exacerbating the healthcare and financial problem. So you know, you've been doing this quite a long time and trying to be a good advocate for Medicaid expansion. Why are folks, one, seeking care in emergency rooms that are uninsured? And part two is, you said this back in 2012, how are things going here in 2021?
Yeah, that's a great question, Valerie. You know, first and foremost, many people come to the emergency room because they just simply don't have a primary care physician. As Mr. England said, if people had coverage, and if you could take people that are in the gap that Rachel talked about and give them coverage, they hopefully would have a primary care physician or a provider, physician practitioner, anyone they could go to help them do routine wellness and help them do prevention. What happens is, unfortunately, they get sick. And when they get sick, they have nowhere to go, so they come to the emergency room. And many times when they get to the emergency room, their condition has worsened because they have put off seeking treatment. Now, how are we doing? Well, we haven't really improved. If you look at the uninsured rate in Texas, you know, it's close to 20%. So let's put that in perspective. When you walk down the street, every fifth person you walk by has no health insurance. And I will tell you, we do everything we can to expand coverage, but in certain counties, and I know we've got people on from Harris County and Dallas County, your uninsured rate is even higher than 20%. That's the overall state average. So we haven't done much better. We are hoping that if we can get expansion through, that's going to be good. But let me point something out. Let's forget percentages. Over 5 million people in Texas have no health insurance. If we can expand it the way Mr. England said, that might help 1 million to 1.5 million people. We still are going to have a large portion of Texans that are uninsured. So we've all got to work together. So from 2012 to 2021, we haven't really done much improvement.
That's what I thought the answer would be that way. So Rudy, Senator Johnson has really taken on Medicaid expansion at full force this session. And, you know, back in 2013, I was sitting in an Austin auditorium watching a debate between Representative Coleman and Senator Schwartner going at each other about Medicaid expansion, you know, 8 years ago. And Senator Schwartner had one main point, which was Texas simply could not afford to do Medicaid expansion. So how well has that soundbite aged?
Well, actually, what we've learned is that if you expand Medicaid, either the traditional way or via an 1115 waiver, it actually has a net positive effect on the state budget. In terms of the cost up front for the program, there's been a large amount of economic analysis done, much of which is available on the Episcopal Health Foundation website. But there are reports by a professor at A&M, also by a former COO and at HHSC, and also by Ray Perryman, who's a sort of a well-renowned economist here in Texas. All of them basically say, first of all, that the cost of expanding Medicaid up front is pretty much a wash under the current state budget. In other words, there are places within the current budget that if you expand Medicaid, you actually can save money that the state's spending out of pocket right now already. So, for example, one of those places is in healthcare in the prison system, where the state right now is paying 100% of the cost. But if you expanded Medicaid, it would be paid 90% by the federal government. So if you go through the state budget and analyze it, what you wind up with is realizing that we could expand Medicaid with very little cost to the state government. And there's also this element called dynamic revenue. If you bring in billions of dollars from the federal government, it's essentially like economic development. You have billions of dollars that come into the economy and they roll over in the economy. And essentially the analysis from Dr. Perryman is that you wind up with making billions of dollars in state revenue and billions of dollars in dollars to local governments. So the net effect of expanding Medicaid is actually a net positive to both state and local governments in Texas, in addition to the benefit to the 1 million to 1.5 million folks who are going to get insurance as a result.
You know, I didn't even think about that who is paying for the medical care for our citizens and folks that are incarcerated. The federal government could be paying for that, yet we're paying for it out of our state budget simply because we didn't accept that expansion. Didn't even think about that. Great talking point. So Ms. Cooper, I'm curious if can you paint a picture for us, and also a two-part question. What does expanding Medicaid have to do with hunger at all? And who are we talking about? Like who would this actually impact in our communities?
Yeah, so Rudy just talked about the big state budget, but when you bring it down to the individual family and their budgets, that's where you really see the difference that expanding coverage can make. Because as Steve said, when a family you can put off healthcare for only so long until something becomes acute. And then the bill is usually much higher, and the impact is much worse. But a family has to absorb that bill, whether it's the doctor's visit, whether it's a prescription, whatever that cost is. And these are families who are on limited budgets to begin with. So something has to give, and often that's food. Often it's either skipping meals or certainly cutting back on the quality of meals. And then you get into this vicious cycle, because we know, and anybody who works in the food world knows, the food bank world knows, that poor quality food and poor diets lead to more health problems. Some of the biggest drivers of our healthcare costs in this country are diet related. Diabetes, heart disease, cancers, those are all diet related illnesses. And they're all exacerbated by low income people not having good quality food because they can't afford it. So it's all gets, people get trapped in this cycle. So that's one of the clearest ways that it links to hunger. And so once again, it's the same family struggling with all of these issues. For folks who work in the food world, there is a connection between Medicaid and the children's meals at school meal programs. Any child in Texas who has already been found eligible for Medicaid automatically qualifies for free school meals. And so that improves their nutrition and access. And so there are those, and the more adults you pull into Medicaid, they will pull their children in too. Because there are a lot of kids who should be eligible for Medicaid, but who aren't covered because their parents aren't covered. So if we find their parents and get help to their parents, the kids will come into the programs and they will also get free school meals, and that'll help because Texas, not only do we have one of the worst uninsured rate, we have one of the highest hunger rates. And those are all problems that concentrated in the same group of families. And we should also talk about the fact that there is a racial component to this. More than almost 60% of all of those uninsured families are Hispanic in Texas, and another quarter are Black. So, they take the disproportionate burden of our choices to not expand. And we need to think about that when we're talking about these policies.
Absolutely. And for those that know me, my background is in health and healthcare. And when I moved from the policy world of healthcare to food, it's the same population of people. Exactly what you're saying, Rachel. Those that are in desperate need of healthcare are also the ones we see that are suffering from food insecurity. So thank you so much for making that point and bridging that gap. Rudy, I wanted to ask you, what does the outlook for Medicaid expansion look like this legislative session? There is no crystal ball, but how's it looking?
Well, if it's okay, I would like to go back to what Rachel was saying first.
Please do.
And then come forward. The one thing, there was a Feeding America study back in 2014, which obviously quite a while back, that said half of food bank clients have unpaid medical bills. And 2/3 reported having to choose between buying food and paying for medication. So that tells you, that if you can expand Medicaid coverage, that can reduce the out-of-pocket healthcare expenses these folks have to pay and make more funds available for buying food, right? So it's all things are connected. When it comes to the legislative session and what are the prospects for passing Medicaid expansion this session, either as an 1115 waiver or outright, we're still climbing uphill, as it were. I forget what the percentage was that Senator Johnson gave it the other day. It was less than 50%, but it wasn't as small as you might have thought. We're still working really hard, trying to, and Senator Johnson's been meeting with members in both the House and the Senate to talk about Medicaid expansion. You know, we had, as you mentioned, the conversation from 2013, that one issue about the financing piece for Medicaid expansion is just one of a number of myths that have been out there. And frankly, they haven't been addressed. A lot of folks still believe them to be true. So we're having to dispel those myths and at the same time present this additional information from Dr. Perryman and the other economists that I mentioned earlier to let them know, hey, this is a good deal for not only, again, do we help insure 1 million to 1.5 million Texans, we also make money for the state. And now that message is slowly beginning to creep in, I think it's enhancing our chances. I wouldn't, again, like I said, I don't think Senator Johnson put them over 50%, and he's the one who's been having those one-on-one conversations. But they're certainly higher than anybody, I think, expected going into the session. And I think we're going to continue to make that kind of progress. But that's kind of where things are right now.
I'm going to put you on the spot. And if you don't know the answer to this question, no worries. How many federal dollars do you think Texas has missed out on when we had the opportunity and we didn't do it? If you want, I can come back because I have another question for Mr.
Well, I'm trying to remember. I think Dr. Perryman had done some work on this at one point in time, and my recollection is that we're talking about $20 billion, and that may not even include the entire time period since expansion. Steve, do you recall?
Yeah, it's pretty close to 80 billion. It's what I saw. If you go all the way back to when the Affordable Care Act passed, because it started out at 100% and it graduated down to 90%. So it's pretty close to $80 billion we've left on the table.
And
yeah, I think that 20 billion number was for a biennium.
Probably. And I want to connect the dots there. So that means us as Texans are paying federal taxes to pay for Medicaid in California, in New York, in other states that have expanded Medicaid, and they are getting the benefit of the Medicaid expansion, yet we as Texans are still paying for those federal dollars, and that's not coming back to Texas. So that's a connection point I wanted to make. Mr. Love, I wanted to ask you a question. It's a little not fun question, but I think it's something that can be very helpful. We've got Easter coming up soon. We've got holidays coming up soon. We all have Uncle John who sits at our table. We all know Uncle John. He's you and my favorite uncle. He's a Texas citizen. He's got a great job. He's good insurance. He's never really had to think about, where healthcare is going to come from. And he believes in the power of hard work. And he's not going to do this whole Medicaid expansion. We don't need that agenda on the Texas board. How do we talk to Uncle John? What are some easy ways for him to understand why this is important, critical, and matters to him?
That's a great question, and I've been answering it for 10 years with a lot of state senators. So let me.
We all know Uncle John. He's a good guy.
So this is Uncle John. First and foremost, let's state what you said. Just so folks know, New Mexico, Arkansas, Louisiana, Oklahoma has voted to do it. They have expanded Medicaid. We pay federal income taxes in the state of Texas. We may not pay state income taxes, but we take federal. So Uncle John, did you know you're paying for the healthcare coverage of people in Louisiana and in New Mexico, but you won't pay for the people's coverage in Texas? That makes no economic sense to me whatsoever. Number two, you may have health insurance, Uncle John, but your premiums are higher than they should be for something called cost shifting. And I don't want to get into a lot of technical, but I spoke at Fort Worth one day and a car dealer raised his hand. He was not being sarcastic and said, "I've never understood cost shifting. Can you explain it?" And I said, "You sell 4 cars today, but on the 4th car, you give it away free." He said, "Well, if I did that, I'd have to raise the price of the other 3. I said, "That's cost shifting. That's why your Blue Cross premiums, your Cigna premiums are higher, because you're having to subsidize people that are uninsured that can't pay. The other reason, don't tell me that you're gainfully employed, Uncle John. You just heard what Rachel said. Most of these people that are in this gap are working. They're the working poor. 75% of the people, if we expanded Medicaid, are in a household where someone is gainfully employed in the service industry, but they fall in the gap. The other thing is, if we help people get coverage, Uncle John, and we get them healthier, it's going to improve their productivity in the workforce, and it's going to have good economic benefits. That's really going to help us. And then finally, it's the right thing to do, Uncle John. Did you know the University of Michigan last year said 730 Texans die and have died every year because we didn't expand Medicaid? It's the right thing to do, and now's the time to do it.
So you can make it to my house on Easter, right?
Right.
I'll set a table for you, or place at the table, don't worry. Rachel, I wanted to come back to you real quick. I think what you said a little bit earlier about our marginalized communities and communities of color are suffering because of this, related to food or related to Medicaid, not having health insurance. Could you expand a little bit more about, it's such a complex topic, but maybe why these communities are suffering the way that they're doing right now?
Well, I mean, it's not a news or surprise to anybody that in Texas, we have this, unpleasant history when it comes to race. And, folks are often trapped in lower wage jobs, not just low skill, but low wage jobs, right? They have a harder time getting jobs that would pay not just a living wage, but offer benefits. But yet this is more about healthcare, but it also connects to the fact that we still have a minimum wage of $7.25 an hour. I mean, it's hard to believe, but there are still places in the state where that's all people are earning for an hour's worth of work. So I always get really frustrated, especially I'm at the legislature, and as Steve said, people talk about hard work, and I'm like, I'm sorry, but for the jobs that folks do for only $7.50 an hour, how can you say that they're not willing to work hard? They're harder working than the rest of us. So it becomes this situation that they don't have access through their jobs. The state has chosen to lock them out of coverage, and those kids in those families don't get the services, the attention, the health care that they need and they deserve. And so you trap families into these systems and make it harder for them to ever move up and accomplish all they want. I mean, when we do this, it has real life consequences. I think if you start talking to people, you start finding out how many people you might know in your social circle who you thought were okay, but when you start talking, they're actually uninsured. I know of a grandmother who's raising 5 of her grandchildren. Okay, she had to stop work. She took them from the foster care system. So she's helping those children. She's helping the state of Texas. She's raising those kids. She had to give up work to do it. She has no health insurance. So when she got sick, she had to delay care and finally just drive to Mexico so that she could pay out of pocket because she couldn't afford care in the US. And if something happened to her, what happens to those 5 kids? Why is that okay? What is the point of setting up a system like that? Healthcare should be one of those things that anybody can access when they need it. And this is not, if all these 38 other states have managed to figure this out, why we can't do this makes no sense. This is a choice that we can, and we can choose it if we pressure our legislators, we call them, we talk to them, we tell them, it's time, do this already.
Absolutely. And with the other states ahead of us and way ahead in the game, you know, you can see what benefit it has brought to that state. And it seems like no matter how often you talk about the subject, it's like, but look at what's happening. It's absolutely great. Mr. England, I wanted to ask a question about, I was going to try to go the whole conversation without bringing in COVID, but here it is. What has Texas taken advantage of during the COVID crisis in Medicaid? Have we tapped into that? Yet we seem so against it, but haven't we tapped into a few things that are benefiting Texas right now?
Well, there is an increase in that percentage that that Texas gets for its current Medicaid program as a result of COVID. So there's I forget the exact number, but it's in the 6 percentage point range, I think, that that Texas gets an additional percentage of what they call the FMAP rate for Medicaid. And that's the main thing that I know of in terms of anything that directly related to Medicaid from the federal government. And when you mention COVID, the other thing that I think is important to recognize is there were a whole lot of folks who lost their jobs, and there was a large jump in the folks who lost their employee-sponsored health insurance too. So what that originally, you know, highest in the nation uninsured rate actually went up as a result of COVID. So it only exacerbates the problem. And I think, you know, from the legislative perspective and the chances of getting the legislature to do something about it, I think that's actually added to the arguments that we have to encourage folks that, hey, again, now's the time.
Yeah. And, you know, Heather Mustaine, are you reading my notes? Because that's my very next question. Mr. Love, could you tell me what is the main reason why folks don't want to expand Medicaid? What is that other side of the argument? What is the primary one?
Well, I'm sure Rachel and Rudy have heard these too, but here goes. Number one, the Medicaid system in Texas is broken. Why do we want to put another million people in a broken system? I actually had a state senator tell me this 2 weeks ago. Well, we've only had, since the Affordable Care Act passed, all that time to fix this so-called broken system. So I really discount that. Medicaid isn't perfect. You have different Medicaid programs throughout the nation. You know, one of the questions in the chat that's been repeated that I'll cover right now is, why can't we incentivize more physicians? Great question. We need to. About 25% of physicians in Texas participate in Medicaid. Very simple. We need to increase the reimbursement. We need to increase the payment to the physicians equal to at least Medicare. And Senator Johnson has that included, I think, in his bill. The other thing is it's going to add to the national deficit. So we don't want to be part of expanding the national deficit. You know, you just heard about the money we took under the CARES Act. You just heard about the money that we take for bridges and highways that are federally funded. We don't seem to worry about the deficit then, but we do when it comes to healthcare. Makes no sense at all. The other one is, and you heard Rachel touch on this, 38 states have expanded. They're really going to regret it. Did you know that, Steve? And when this whole thing implodes, we're going to be one of the 12 states that didn't do it. And I said, well, let's see, I'm not good at math, but let's take 38 states and multiply it times 2 senators. So you think 76 US senators are going to let Medicaid expansion fail? There is no way. They could even beat the filibuster on that. That is absolutely no argument. The other thing is we can't afford it. Texas can't afford it. Well, in addition to what Rudy's told you, Texas A&M did a study. Ray Perryman did a study. There have been other studies that have been done by the Kaiser Family Foundation. We can afford it. In fact, my argument is we can't not expand Medicaid. We need to do it for all the right reasons. I could go down more, but I just hit the primary ones. And the other one that I like to give is, well, the federal government's going to renege. You know, we just heard Rudy England say they're going to give us 90%. In 2 years, they may cut that to 50%. And I said, well, do what a Republican governor did in Arizona. She put a blow-up provision in their contract in Arizona when they expanded Medicaid. If the federal government ever pays less than they said they would, then this becomes null and void.
It's a really good point. Mr. England, I wanted to ask you about what Senator Johnson is proposing in his bill. You know, my childhood best friend, she is a pediatrician out in Rockwall, and she recently had to stop taking Medicaid patients because the payments were just not, she wasn't able to pay the bills with the amount of patients they were paying. So talk a little bit more about how the provisions that you're putting in are going to help her, protect her and her practice, as well as her being able to open up and see Medicaid patients again, which is something she really wants to do.
Well, so the bill that Senator Johnson has filed, he's actually filed more than one, because he has filed bills that actually do simply expand Medicaid. One of which would put it to the voters via a constitutional amendment, which he filed last session also. But this session, we've also filed a bill called the Livewell Texas program. It's Senate Bill 117. It has a number of special provisions that try to make it more of a Texas-specific kind of bill, like I was talking about earlier. One of the things it does do is it does increase the reimbursement rate for physicians. So hopefully that allows them to see more patients. If we can do that for the expansion population, even if we can't get an increased reimbursement rate for the existing Medicaid population, the fact is that additional funding for the expansion population will hopefully at least help folks, physicians who want to see Medicaid patients, be able to afford to see some of the other folks too. That's not a panacea. It's not a great solution, but that's one of the things that we've done. And another thing that, as Steve mentioned, one of the other provisions in the bill is an opt-out, essentially, that says if the federal matching rate ever drops below 90/10 or becomes unmanageable, we just don't do it. As distinguished from Medicaid expansion, the 1115 waiver is something that gets renewed on a regular basis. So there's also the possibility that you just don't renew it if it were to become something that you didn't really want to do, if it really wasn't living up to the expectations. So there are those kinds of things that are in there. There's also what we call personal health savings accounts that are there that folks can access to help give them some incentive for healthy behaviors and smoking cessation, those kinds of things. So some things that would make the expansion more palatable for folks who are on the more conservative side.
Yeah, makes absolute sense. Ms. Cooper, you're every Texan, and you do such great advocacy work. And could you tell me a little bit about what you guys are doing to help promote Medicaid expansion and try to get more folks on board with making this the right thing to do for Texas?
Yeah, well, we have a whole team at Every Texan who have been working on health care and expansion ever since this became an issue, right? Since for the last more than a decade, Ann Dunkelberg and her team have been working on this, and we'll continue to work at it. And we're at the legislature making the arguments, showing the data, but we also understand that this has to come from the ground up. They have to hear from Texans, everyday Texans, the people on this call, with or without health insurance, that this matters. So we are part of a group of the Sick of It campaign that we are hoping that people join that campaign, which is about getting the word out to the legislature and others that it's time to expand. And so we hope that, I think you'll show that information later, but it's Sick of It, Texas. And they have all around the state, there are groups all around in every city in the state working on this campaign. So hopefully folks will
Great.
join that.
Well, Mr. England, talking to your elected official, talking to your representative or your senator, does that even work? Is it worth our time to weigh in? Do you guys listen?
Yeah, absolutely, it's worth it, especially on a topic like this, especially with the additional information out there that has dispelled many of those old myths. While we're talking about it, just a couple other things I want to mention. That Senator Johnson has put out a video that's specifically about Medicaid expansion. If you're on his email list, you've already gotten it. If you're not, it's on his website. And I think I noticed earlier that someone had posted that website in the comments section here. So another thing to do is to share that video with your friends and relatives that live around the state. There are, depending on where folks are, their legislators may be more or less inclined to expand Medicaid, but the more they hear from folks, the more likely that's going to happen. And so don't just call your legislator, share the information with your friends and relatives from all across the state. We really need, as Rachel said, a bottom-up approach to put the pressure on folks and to actually raise awareness to let them know what we're not doing and how much it's costing the state of Texas to not do it.
Yeah, and Mr. Love, from the hospital point of view, why is this a nonpartisan issue?
Nonpartisan to us, and I'm not being cute, we treat Democrats and Republicans in hospitals. They both get sick. But the reason it's near and dear to us, and I'll be the first to say, are we conflicted? Well, you're treating these patients now in your emergency room and not getting paid. If you get Medicaid expansion, you may get patients and get money. Okay, I plead guilty. We may get a few more Medicaid dollars, but that's not the real reason. We see people coming to the emergency room. When a kid comes to the emergency room and is having a severe asthma attack, and then we have to give rescue medication, and then they end up coming back because unfortunately the conditions where they may live are damp and have mildew, etc. All those social drivers of health we see, and we know the economic insecurity tied into food insecurity affects health. The other thing that we see are the adults, and even some that have Medicaid, something we haven't even talked about that I think this group should know about. I know Rachel does because she does such great work in it, but even though pregnant women do have Medicaid, we don't give good, what I call postpartum benefits. Texas has one of the highest maternal mortality rates, especially people of color, in the nation. And we need to expand that because of suicide, cardiovascular, all these issues. If we could improve that Medicaid coverage there, we could reduce, hopefully, maternal mortality. Hospitals see this. We know things that would help. And to go back to Rachel's point, 64% of Texans last year answered an Episcopal Health Foundation poll saying they favored Medicaid expansion. To me, if I were a state legislature and 2/3 of the citizens in my state, assuming it's a statistically sound poll, favored Medicaid expansion, that would get my attention.
Absolutely. And thank you, Rachel, for the work that every Texan does do on that. The maternal mortality rate is, we should put on another seminar about that because it is something in Texas that's just absolutely not acceptable. And when the Medicaid and postpartum issue, it's devastating. We'll have some more information on that later, probably.
I will
But
tell you
go
this,
ahead.
in the bill, the 1.9 trillion, which we hear about, actually in that bill, they're trying to extend that to 1 year. So that's
That'd be great.
actually one of the provisions that's in that. Now, whether it's going to pass, who knows?
We'll find out. I wanted to ask Denise or Wyanella, will you go ahead and put the slide up? I think we're at our time, so we wanted to get a chance to look at, here is the call to action that we have for you guys. And if somebody would like to drop that URL in the chat as well, this is tomorrow. So it's a virtual advocacy day. There's your hashtag. There's, the Twitter storm. Talk about what Medicaid expansion means to you. You can go to that URL and learn more. And we know that advocacy works, and we know that our state representatives, state senators, Republican, Democrat, anybody, they want to know what their constituents think. There's no room for cynicism in this, right? They need to know what is important to us and what is important to their citizens. So please visit that. And see, Denise, am I missing anything?
No, I think you covered it. Thank you so much, Valerie, for
Sure.
leading us in a really great discussion with our speakers. On behalf
Great.
of the coalition and also our policy action team, we want to again thank everyone for participating in this wonderful panel. To our guests, thank you again for sharing your insights and sharing your time with us.
And I have a few more thank yous I forgot to do, so sorry about that. I wanted to say thank you to Wyanella, who helped put this together. She's with Baylor and all the fabulous coordination of Dallas Coalition for Hunger Solutions. Thank you to Jenny Iyer with American Heart Association. Thank you to Stephanie Mace for United Way. And of course, thank you to Denise Gomez with Children's Health for making sure that this got put together. I am excited to see so many of our friends. I see all of your names in there. I see you, Marlene and Shane and Mr. Beckert and Heather and Meredith at City Square. Thank you so much for being on here today. I know taking an hour out of your time is really difficult. So with that, Denise, I'll hand it back to you.
Well, I think we covered it. We just wanted to thank everyone and looking forward to following up with an email with this information, but I highly encourage you to RSVP today because the virtual advocacy day is actually happening tomorrow. So if you have an opportunity to jump off this meeting and quickly RSVP, we'll be sending out the URL in an email as well, but we'll love for you all to participate tomorrow.
Okay,
Thank you.
Thank you so much, Mr. England, Mr. Love, and Ms. Cooper. Have a great rest of your day, guys.
Thank
Bye.
you.
Bye, thank you.
Sure.
Thanks.